would be. It is a time to talk to Janette. Janette Angulo is on the line. Good morning, Janette.
Good morning, George. How are you?
I'm doing just fine, buddy. Until it gets hot, I'll be great.
Yes.
This is our weekly conversation on COVID-19. And you are the perfect person to talk to because Janette just happens to be the director of the County Public Health Department. And that's a job that I wouldn't want, Janette, but you're doing a great job.
It was an interesting job to be in, George. But, you know, a year and a half later, here I am.
Yeah, I bet it never boring.
Never boring.
Okay. And I have a question to lead off with, and it doesn't sound like it has anything to do with COVID, but it does, because the cool centers were shut down because of COVID-19. The heat is coming back. It's going to get really, really hot next week. Will the cool centers be opening up?
Yeah, well, you know what? That's a great question. Last year during COVID-19, because of the pandemic, what the county worked on were hydration stations and, yes, cool centers. That's what we're working on again this year. And we're working with our different partners, different cities, and I'm looking at the flyer that should be going out very soon. So we'll have either hydration stations and or cool centers, for example, in Calapat, Heber, Nyland, Ocotillo, Hopeville, Palo Verde, Winter Haven, Sealy, and some other areas. So yes, something is being worked on.
Okay, when they opened up that brand new safety center, the substation and the fire department in Nyland, one of the promos was that it was also a cool center.
Yes, and I have Nyland County Fire Station listed here, so that will be one of the cool centers. And
the hydration centers are basically parks that are close to water fountains, right?
That is my understanding. Water distribution, yes.
So they will, with the people that go outside, will have some place to go next week.
There's going to be options for them, yes. For those looking for cool centers or hydration stations, there will be options out there. And
the best option is if you have an air conditioning home, but stay home.
Yeah.
Okay. How are we doing COVID-wise? Next week is also the grand opening of everything.
Yes, June 15th is right around the corner. How are we doing? Let's talk a little bit about testing. Testing continues. We actually are doing a bit more testing than the state as a whole. We do have a little under 50 active COVID cases, and I think that's been the lowest since the pandemic started. As far as case rates and positivity percent, we're doing pretty good there. We've maintained around a 2 point, case rate per 100,000, and positivity percent is also in the 2%. For this last run that the state did, we were actually at a 2.7 adjusted case rate with a 2.1 positivity rate. And then looking at the daily numbers this morning, they're still around the same. So we're pretty good.
Well, I actually, the numbers that I've been doing the reports every day, and they seem better than the state. We're doing better than the state.
Yes, there are times where we are doing better. We have been doing better than the state. So our community has been doing an awesome job.
I think we should pat ourselves on the back because we started off as one of the worst counties in to get hit by the COVID.
That is right. That is right. We were the hot spot of California for quite some time this last year.
And to turn it around to being one of the most improved counties, that's an incredible accomplishment.
It is. It is an incredible accomplishment.
Is Gil still standing there?
Gil is here.
Gil, pat her on the back, buddy. She did a heck of a job.
Yeah, hey, George, Gil. I think it's like Janette said, the community gives us momentum going into the reopening of our numbers being very low. And I think, like I said, it's not just Janette, but also her staff, the crisis communications unit, all administrators, all those epidemiologists who've been working hard. It's been a very wild past 14 months, and all the staff of the county has come together to really just do a great job in working.
You could name everybody you want, but Janette is the one that planned everything. she is the one that that everybody followed her organization, and she did a fantastic job. This lady has got to be recognized when we get out of this.
Team effort, George.
Yes, well, of course it is, but I'm putting in a good word for you, Janet.
Thank you so much. And you know what? Something else that has been a great tool that has brought down our case rate and our positivity percent has been vaccination. We've had over 30 vaccine dispensing points, and our community has accessed each and every one of those. Not only that, we have vaccine providers, including the public health department, that took clinics on the road. And so we've been doing mobile clinics, travel clinics for many months now. And the results of that work includes for our community, and this is only county residents, we are very close to reaching 170,000 first and second doses administered. And that is amazing. When you look at percentages of the eligible population, that means 65.3% of our 12-year-olds and older have at least one dose of the COVID vaccine. And we're very, very close to 50% fully vaccinated. The exact percentage is 48.9%. So doing really good there, too.
Okay. I have noticed that also in watching the numbers, that it's sometimes it's not a tremendous increase, but it's always a steady increase on vaccinations.
It is. And most definitely back in February, March, we were doing a lot more vaccination. And there was a downtrend when it came to vaccine demand. But in Imperial County, between all vaccine providers, we've kept it at about 5,000 to 6,000 doses administered per week. So not bad at all.
Not bad at all. So we are, when we come to be open on the 15th. Now, last week, the governor said the emergency declaration was going to remain. He's not going to eliminate the emergency declaration, not yet. But the opening is going to happen. We're going to be less stringent, right?
The opening is happening on June 15th. And for many that were following the blueprint industry guidance, most, if not all of that industry guidance will be retired on the 15th. Now, there is an important piece here that we would like to highlight, and it's the face cover guidance, the masking mandate. So there's two things going on. The California Department of Public Health issued updated guidance earlier in the week. And that guidance really is for the general population. Now, we have the California Department of Industrial Relations, and more specifically, Cal-OSHA, who issued emergency temporary standards. Now, that's the key for employers subject to Cal-OSHA standards. They still need to follow past June 15th such temporary standards. So what happened in the last 2 weeks is that the Occupational Safety and Health Standards Board, they held special meetings. They actually held two, one last week, one this week. And they were discussing updates to the emergency temporary standards that were issued back in 2020. Well, the end result of that was that the board decided to withdraw revisions to the emergency temporary standards that were previously sent to the Office of Administrative Law to review and update. And so what that means is employers subject to Cal-OSHA need to follow the November 2020 emergency temporary standards. Those are the ones that remain in effect. So those are the two key things to keep in mind.
Now, normally, Dr. Monday will issue a change. Every change there is, he issues a statement and a bit of an explanation on why the change is happening. Will we get one of those?
Yes, we will. And we started working with our county council to draft that health officer order, and it will be ready and issued. So, yes, expect an updated health officer order to align with the June 15th reopening.
So we will know exactly what we can do, and we'll be able to inform everybody before it actually happens.
Yes, and something to note is that although, local counties can be stricter than the state, we've made it clear. I mean, we've done such a great job. We've sustained, at very good levels of, case rates and positivity percent, that the Public Health Department, Dr. Monday, doesn't intend to be stricter than the state. So whatever the state issues, that is what we're going to follow. Of course, if our situation gets worse, hospitalizations, they're out of hand, then we will meet and talk about, next steps for Imperial County. But at this point, Imperial County does not anticipate being stricter than the state.
So we just use common sense.
Yes.
And keep yourself clean and keep the mask handy. Because if you go into a place where there's a bunch of people, you're still going to need it. Yes.
And something to note is the updated California Department of Public Health guidance does talk about, vaccinated versus not being vaccinated, and outdoors versus indoors. The risk is higher when you're indoors and you have individuals that, are not vaccinated. So that's one. And then the other piece about masking is, if someone wants to wear the mask beyond June 15th, even if it's outdoors, even if they're, there's a crowd, but it's their distance. I mean, it's their choice. It is their choice. And we also have to remember that we still don't have a vaccine for children younger than 12. So it's for a couple of reasons that it may be a good idea to just keep wearing the mask.
Exactly. And one of these days we got to get you on here, and so we can go through and debunk all those weird stories that people are using as excuses not to vaccinate.
Yes. And that's a great point, because we still have individuals that are thinking about it, doing their research, and that's totally fine. What we do encourage is our community to look for information from trusted sources, because there is plenty of information but out there, but sometimes the information is very doubtful. So trusted source, California Department of Public Health, Centers for Disease Control and Prevention, Imperial County Public Health Department. Check with your doctor. I'm sure they'll be more than happy to provide you more information.
Okay. All right, Janette, I'm going to let you go, because we have done a fantastic job, and you guys still got more to do. So I thank you for talking with us and filling our ear with information.
Thank you, George. It was a pleasure. Have a great one.
You too. Bye-bye. And go take Gil for a cup of coffee or something.
I will. Thank
Gil,
you.
buy her coffee.
I will.
Okay. Thank you, guys. I'm sure we're going to do this again. Oh, Carol will do it next Friday to probably discuss how the opening went.
Yeah. We're going to look forward to that conversation next week.
Okay. Enjoy the rest of this week and have a great weekend.
Likewise. Thank you.
Stay out of the sun. Bye-bye. That is Janette Angulo. She is the director of the County Public Health Department, and that is our weekly conversation.